As the country observed World Mental Health Day, which fell on the 10th of October, practitioners and experts gathered at the American Center for Psychiatry and Neurology's inaugural conference, which aimed to raise awareness on mental health conditions and their strong connections to our physical health. Medical professionals, doctors and nurses gathered at the inaugural conference in Sharjah, where senior psychiatrists from a number of hospitals delivered lectures on the importance of considering the mental impact of a patient's physical injuries. During the lectures, medical experts stressed that mental and physical health are strongly related, with many often suffering from depression. It was added that almost 50% of diabetes patients suffer from low self-esteem and are impacted by depressive disorders which often go unnoticed. Dr. Rasha Basim, a consultant psychiatrist, stressed that patients can also suffer from chronic anxiety, which leads to the fear of narcissistic injury. Intervention treatment was identified as a main treatment method for psychological conditions. Among the new methods introduced in the country is TMS, which, according to Dr. Rasha, has a 95% success rate for patients globally.
Sometimes we turn to having the brain synchronizing treatment, which is known as the ECT, and the new intervention now into the world is the TMS. That is actually a revolution in the treatment of depression. It's just like a sessions you have every day, 5 days consecutively, and then you take 2 days break. Consecutive 5 days followed by 2 days. This is a week, so treatment goes from 4 weeks to 6 weeks actually. No medications are taken while you're taking the sessions. There's no medication, and most of the cases you do not take medication after one.
According to organizers, the conference aimed to develop more collaboration between different hospitals and clinics in a bid to increase their focus on monitoring the psychological implications of their patients.
A lot of recent studies have showing that curing a person with a physical problems is not enough. You have to put special attention to the psychological part of it. For example, in diabetes have shown that many of them, up to 50%, they have depression. And if you treat depression, actually their sugar level get more stabilized. Same research have shown that in people who have heart conditions or they get recurrent heart attacks, if you treat their depression, their life or they live longer than the people whose depression is not treated. When they come in contact with the presence of a stigma, they may not come directly to me as a psychiatrist, but they could go with the multiple complaints to other specialties, for example, general GPs or for other general clinics. So it's important for the clinician to understand that they need the assistant or an expert in the mental health.
And finally, in the bulletin,